morning.
Good morning.
Brandon Barrett.
Good night.
We're here today to discuss COIN, first aid, CPR, basic life support for the building trades. We're going to talk about cardiopulmonary resuscitation today. So what's that mean to you guys? Anybody take a guess what cardiopulmonary resuscitation means?
Your heart and your lungs.
It does. Cardiopulmonary means your heart and your lungs. Resuscitation literally means to reanimate something or bring it back from apparent death. So cardiopulmonary resuscitation, right? Bring your lungs and heart back from apparent death. What do you think of when you think of CPR or cardiopulmonary resuscitation? George, what do you think of?
Somebody unconscious.
Someone unconscious. Excellent. So, to understand CPR, you kind of got to understand the functions of the heart and the lungs. I found a video because this doctor is much better at explaining this than I am, and it seems to go pretty smooth. Let me hit the lights here. We're only going to watch about 1.5 minutes of video, but it makes a little bit of sense.
About the size of your fist, the human heart is the most important muscle in the body. It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of 4 major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again.
So the heart's basically an incredibly efficient pump, lined up with a bunch of check valves. Something you millwrights understand, right? Pumps and check valves. Just for your understanding, the main function of the heart is to provide a power source to move blood. What does blood do for you guys?
Transport oxygen.
Right, that's the main function of blood, to bring oxygen to cells and remove deoxygenated CO2 from cells. It also brings food to all your cells and waste, but that's another discussion. So blood is the delivery system of oxygen, right? What part of your body do you think is, I want to say, requires the most oxygen? Or is the most oxygen dependent? It's not your lungs. Your lungs are actually just sacs. Your brain. Right? Your brain tells everything what to do. It tells your heart when to pump. It tells your liver when to filter. Right? Your brain needs the most oxygen. And that's really what CPR is. We're circulating an oxygen delivery system to your brain because your brain requires oxygen at all times. Now, if you're unconscious or you get knocked out and you're not breathing, what happens to your brain? After about 3 to 4 minutes, you can have some serious damage. 1 minute, your brain cells start to die. 3 minutes, you start experiencing some serious brain damage. 10 minutes, most of your brain mass is dead. At 15 minutes, recovery is virtually impossible. So again, we know the definition of CPR. We know the idea of what the heart and lungs and blood do. So what does CPR actually do for you? Anybody want to take a guess?
Compress your lungs to circulate your blood for you.
All you're doing. You're becoming the pump. You're going to move blood around of the human body just to bring oxygen back to the brain for long enough for emergency medical responders to reach the patient, or you bring that patient to a hospital. They got to be prepared. According to the AMA, the CDC, and the Red Cross, they vary a little bit. CPR only has about a 10 to 20% success rate. Be prepared for failure, but it's better than nothing, right? So to perform CPR, how do we perform CPR? The first thing we do, and this little book that I gave you guys last week, made by Coin, makes a lot of sense. They have what they call a 10-second survey. And I'm sure some guys in the military, you have something very similar to this. Your 10-second survey, your first 2 seconds belong to you. So you need to assess the scene. Is it safe? Are you going to go perform CPR on a guy in a burning room? No, right? You're going to try and pull him out of the room first. Or is it safe for even you to go in? Never give a life to save a life. Number 2, call out for help. CPR is much easily done, more easily done if you have someone else to help you. Right? If you ever perform CPR, it's physically exhausting. Having someone else to help you helps out a lot. But having that second person, even if he's not a trained respondent, helps out a ton. Because now you can delegate. You can say, Fred, go get the AED and call 911 while I start to perform CPR. Because be honest, you're probably not going to resuscitate someone. You're just going to keep their blood circulating long enough for some kind of medical expert to help out. Number 3, check out neck and back injuries. And we did touch on this in first aid last week. If a guy's neck is severely broken or if he's got a severely broken back, you might want to try to address some of those things first before you render any aid. The only thing that takes precedent over neck and back injuries is severe bleeding and not breathing. So if a guy's got a broken neck and he's not breathing, are you going to perform CPR? Of course. He can still live. But if he's bleeding out, are you going to perform CPR? No, you got to stop the bleeding first. So you kind of have to assess, and that leads us into point number 4 here. You have to be a triage nurse. You have to assess what is more important, what do I treat first, who do I treat first. All this you got to do in 10 seconds too. It seems like a lot, I understand. Number 5 is your primary survey. Now we're starting to get into the real deal. You have to establish a visual contact. Who am I going to help? Can I see that person? You have to establish response. So, you just go up and wave your hand in front of him? No, what if he's in shock or something? Or people who experience traumatic events, they tend to not be with it. So what you do is, if you know the guy, which is a very good chance, you walk up and you tap him on the shoulder. Say, hey Kevin, you okay? Are you all right? Don't smack him around, just tap him enough to try and gain response. If there's no response, you check airway. Okay? Is he breathing? If he's not breathing, the first thing you do is a technique we call the head tilt chin tuck or chin lift, which is how you're going to deliver breaths in CPR, but we'll get to that in a second. You're going to tilt his head back to open his airway up. Because you can't breathe with your head down, right? But you can breathe with your head up. And sometimes it's literally that simple. Tilt his head back and open his airway. Is there some kind of obstruction? If there is, turn his head away from you, scoop it out. Again, that might be all it takes. Hopefully that's all it takes. Number 5 is to just make sure he's breathing. Sometimes it's pretty faint. Can you do CPR on someone who's breathing?
No.
No. If he's breathing, his heart's beating. If you start pounding on his chest, you're going to screw up that heart rhythm, right? So you got to really make sure is he breathing or not. They used to tell you to check a pulse, but that's too hard to do, especially when your adrenaline's pumping. It's hard to feel a pulse when your adrenaline's pumping, or if his pulse is really weak. You're not really a trained medical respondent. You don't really know where to look exactly for a pulse, right? So just check if he's breathing. going to hit our secondary survey next, and that is really only if this man or victim starts to breathe again. Your secondary survey is injuries. For this lesson today, we covered that last week. We don't have to worry too much about a secondary survey. But again, follow your steps. And 7 is to notify EMS and perform CPR. If you're by yourself, you're going to give 5 cycles of CPR before you notify EMS. In this day and age in cell phones, what you're going to do is you're going to get your cell phone out, you're going to dial 911 and throw it on the ground next to you on speakerphone while you're performing CPR. If for some reason you don't have a cell phone with you, make sure you give 5 cycles of CPR first before you go notify EMS or find an AED, an automatic defibrillator, right? We're going to do that lesson next. Okay, so how do we do CPR? 30 compressions in 1 breath, but what's real important is your form. Because you cannot stop doing CPR until medical experts arrive, or you're physically unable to perform. So if you're totally exhausted and you can't perform anymore, which is a possibility, that's acceptable. Or if the scene becomes too dangerous to perform CPR, that's acceptable. Other than that, you can't stop. And it's a whole body workout, trust me, it's tough. What you're going to want to do is, you don't necessarily have to de-shirt everyone, okay? But it does help to locate the sternum, which is your breastplate, and the lower half of that sternum. Basically, you're looking for the nipple line. You're going to take the heel of your hand, you're going to put it on the nipple line. Take your other hand and just secure it right on top. It can be like this or like that. Don't squeeze them because you're going to wear out quick. And then what you're going to want to do is raise yourself up over the person so your shoulders and wrists are plumb. If you're back here, you're just pushing with your arms, you're not going to push hard enough. And you're going to wear out quick. You have to deliver a compression about 2 inches, 2.5 inches. Well, how do you know if you're pushing somebody's chest in 2.5 inches? That's pretty difficult. We got these fancy dummies here to train you and get you used to it. It's got a little gauge over here, and when you push hard enough, you're going to see a green line pop up. That's about 2 inches. It almost looks like you're caving in somebody's chest, but that's kind of what you need to do to pump blood throughout someone. And on a side note, this doesn't work unless you're on some kind of tough surface, something firm. If you're on a big pillow or a bed, it's not going to work at all. Drag somebody onto the floor. So first, you begin CPR with 30 compressions. How many beats a minute? Any idea? About 100 to 110, actually. Your heart beats about 60, but what they find is you're going to compress so many times that isn't going to be deep enough or good enough. You need to aim for about 100 to 110 beats per minute. And conveniently, the Bee Gees song "Staying Alive" is about 105 beats a minute. So you think to yourself, staying alive, staying alive. In your mind, seriously, and you're going to count 30 pumps. After 30 pumps, what do you do now?
Breathe twice.
Breathe twice. But it's real important. If you breathe, you got to make sure you open that airway up. You're going to tilt his head back, inch his nose off, and without crushing his head and leaning on it, right? You're going to open his chin up. And you're going to breathe. Make sure you close the nose. If not, the air is going to come right back through. Again, you're not going to have a dummy showing you that you're breathing hard enough, like we do here. We're just going to try to get you used to it. So what you do is, kind of with your left eye or your right eye, whatever you're looking at, you just want to see the stomach or chest expand a little bit, and that's enough breath. After 2 breaths, continue. Now this does get physically exhausting, so you're going to hope someone else is there near you. So, again, the first thing you do always, though, is make sure it's safe for you to perform CPR first. Right? If you run into a tank somewhere that someone's passed out in, you run in with great intentions of saving someone and you pass out too. Now they got to pull 2 bodies out of the tank, right? Make sure the scene is safe first. Be sure to compress hard enough and get your shoulders over your arms. Most of the time you're going to be doing this on the ground. You're going to get on your knees and you're going to use your stomach and compress all the way down. Using your arms, you're going to wear out quickly. And you practice universal precautions, which we didn't hear because our dummies are nice and clean. But in the field, if you're responding to people, you grab the first aid kit, you put the gloves on, you put the mask on, right? Because you don't want to contract any kind of bloodborne pathogen trying to save someone's life. And as long as you practice what I've taught you to do, what you've been trained to do with good intent, there's a lot of Good Samaritan laws in place that will prevent you from any legal ramifications if something goes wrong. It is very likely you're going to break someone's rib pushing their chest in 2 or 2.5 inches. Okay, but as long as you're trying to help, everything's okay. All right, so we're going to actually go next door, get all the dummies out, and practice giving CPR. And ultimately, I want to see you guys perform a good 5 minutes of CPR cycles with proper form. Okay? Any questions, guys?
See.